controversies on an old drug. Dacarbazine is a chemotherapeutic drug used in the medical field very frequently nowadays, but suddenly new opinions have arisen about the drug, about its side effects and risks. Rebecca Huff, our star reporter, met with a civilian who has experienced some of the risks and side effects firsthand.
Thank you, Amy. I'm here today with Juniper of the River, someone who has been personally touched and affected by dacarbazine. Thank you for joining me, Juniper.
Thank you, Rebecca, for letting me express my thoughts and my feelings against this awful cure named dacarbazine.
Now, how did you first hear about dacarbazine?
My sister, Jennifer, also known as Fire Eagle, got diagnosed with stage 4 melanoma very quickly about a year ago. It was absolutely terrible.
What was it like watching her go through this disease?
It was the worst thing I've ever seen. She got very tired and very weak so quickly, and her aura just turned black.
Wow, I'm so sorry to hear that. Did things get better after she started this chemotherapy regime?
It only got worse. She started vomiting and she lost her hair. It was absolutely terrible. And then she got rashes and infections, and she got hives as well. I couldn't imagine anything worse.
So now, were these common side effects, or was this just her?
I imagine it was for everyone. I mean, I've heard of some people having bone marrow complications, infections, difficulty breathing, as well as people even developing leukemia, the cancer of the blood.
Are you worried that others are affected by this in the same way, though?
Yes. I believe it's a widespread controversy in the Cancer Society. I believe that everyone is deeply affected by all these side effects, such as rashes and breathing difficulties. It's absolutely horrible.
So I take it you don't support dacarbazine as a treatment plan, then?
Absolutely not. I wouldn't wish this on my worst enemy. It destroyed my sister's life, it destroyed her soul, and it destroyed her life in the next life. It was absolutely awful.
So have you heard of any alternatives to dacarbazine that can be used to treat people with similar illnesses as your sister?
I am very concerned with the care that a lot of people are getting these days by doctors who want to cure their people. I don't believe in this. I believe in alternative cancer cures. Mother Nature will cure us, not the doctors. It's Mother Nature's job to do our work.
So really quick, because we're running out of time, tell me about these alternative cancer cures.
Alternative cancer cures are what Mother Nature does to help us. We create the poison within us, but Mother Nature takes it away. She gives us our bodies, which are temples, and she cleanses them with green tea, natural oils, which we must love into our bodies. We must stay with people who enjoy us and cleanse our aura. She cures the cancer within us.
Okay, well, thank you very much for your time. Amy, back to you in the studio.
Well, it certainly seems that she has some very strong opinions on the matter, and that the risks and side effects do seem quite detrimental. Although today we have a live report with a professional, Dr. Theodoros, Rebecca Huff has visited with her to ask the specifics and on a molecular format how dacarbazine actually works. Rebecca?
Thanks, Amy. I'm here with Dr. Theodoros, a leading specialist in cancer and its overall treatment courses. Dr. Theodoros, hello.
Hi, thank you very much for having me today.
So up to this point, we've heard a lot about dacarbazine, its uses, its risks.
Yeah.
But could we just go over really quickly, what is it exactly?
So dacarbazine is an anti-neoplastic drug, which basically means anti-cancer. Most people are familiar with the term chemotherapeutic. And it treats a variety of diseases such as malignant melanoma, Hodgkin's lymphoma, and soft tissue sarcoma.
Okay. So one of the things Juniper talked about were these ACCs, alternative cancer cures.
Yes.
I hear that's pretty popular with some forms of cancer treatment.
Yep.
What would you have to say on this subject?
The ACCs that Juniper mentioned were very natural ways of treating a disease such as cancer. She mentioned using green tea and natural oils. And while I do understand why some people do take this this way of treating themselves, the reality is, and research has shown, that the death rate is 100%. This cancer, or whatever cancer you have, will kill you and faster than had you gone through chemotherapy. So I do understand that people don't want to put toxins into their bodies, but in the end it really won't help you.
So you believe that taking a chemotherapeutic group will give you more time in the long run?
Absolutely. While some diseases are terminal, so they can't be cured, but the lives of the patients can definitely be prolonged, and I think that's definitely worth trying chemotherapy for.
Some patients choose the route of ACCs because they don't want to endure the pain of chemotherapy. What would you have to say about that?
Like as I said before, chemotherapy is it's not always enjoyable. We already know the side effects: hair loss, vomiting. But just staying with the cancer naturally, it would just be much worse. You would some people get so weak they can't get out of bed. You can develop like memory loss, brain degeneration, depending on the type of cancer you have, of course, but the symptoms will only get worse from where you are if you choose to take no treatment whatsoever.
So, as we've seen, a lot of people are against the use of dacarbazine. What can you say about other forms of treatment that could also be effective rather than ACCs?
There are many similar drugs to dacarbazine, such as vinblastine, cisplatin, and paclitaxel. However, they're not quite as effective as dacarbazine is. There was actually a study that compared dacarbazine to another similar drug called ipilimumab, and it basically it compared the 3 to 4 year survival rate of patients taking both these drugs, and ipilimumab had a 9% effectiveness rate, and dacarbazine had a 19% effectiveness rate. And while these are both relatively low numbers, dacarbazine is clearly twice as effective as ipilimumab and many other similar drugs, so it's definitely the way to go for those types of cancer.
Okay, so obviously side effects are inevitable, but are there any precautions people taking this drug or maybe considering taking this drug should, take?
Well, first of all, the supervision of a doctor is highly recommended to ensure that overdosage or even underdosage doesn't occur, especially because this drug in particular requires a very specific dosage and frequency of dosage, and it varies tremendously among the patients because it can depend on your age, your overall health, your body weight, and what stage you are in the cancer. So it's very, very important that you are getting the right dosage, or else the treatment won't have its proper effect.
Okay, well that's all the time we have for today. Thank you very much for your time.
No problem. Thank you very much.
Amy, back to you in the studio.
Thank you, Rebecca, and thank you, Dr. Theodoros, for meeting with us. It just goes to show you that it's important to get the information straight from a professional source rather than jumping to conclusions. We hope that we've helped you if you have any questions about dacarbazine, and if you or someone you know is being exposed to the drug, please feel free to email us, or you can talk to Dr. Theodoros, who has left their information on our website. More from Medical News 1 after the presentation.